Thank you so much for the rose. We're almost at 100k hearts, you guys. Make sure you guys are liking the live. Alright, can pass me the scalpel, please? Pass me the scalpel.
The plastic surgeon, the star of TikTok, was deprived of her license and is now generally under investigation, who is known online as Dr. Roxy. She has 1 million subscribers. She dances, sings and streams her surgeries. Patients saw themselves on the internet and sued the woman for disclosing medical secrets.
In recent years, there has been an uptick in doctors sharing social media content to the masses. Because of the lack of health resources in the US, many are taking to their phone apps to get expert advice from these content creators who just so happen to be doctors and surgeons. The intention is unclear for some, and some practitioners take content creation to a whole new level, to the point where they completely lose their license due to their videos online. Which leads me to who this video will mainly be about. Dr. Roxy, the TikTok famous plastic surgeon whose social media fame led to the loss of her medical license. What's going on YouTube? Welcome back to my channel. My name is Vantanart, aka Vantanart, and today's topic is absolutely crazy. It's a little bit dated. This happened probably about 2 years ago, 2023, but I figured it was definitely worth talking about and bringing to you. So I was having a conversation with my Twitch audience the other day, and I asked them, would you let a Twitch streamer or a live streamer, content creator perform surgery on you? And the overall consensus was no. Hell no, actually. A lot of people said no, and that wasn't surprising. So I was surprised to know that people go on TikTok to find their plastic surgeon.
For starters, whenever Dr. Roxy asked me to do that TikTok with her, I was like starstruck. I was so pumped for that, and it was just so much fun to make that in the office.
And in the stories that we're going to talk about in this video, unfortunately, a lot of them dealt with severe complications following the surgery with Dr. Roxy, and some of them even were live streamed on TikTok during their surgery.
Kelsey Cardenas went to Dr. Roxy for a breast lift. She live streamed your surgery.
She did.
Do you feel that that could have contributed to what happened? Do you think she wasn't paying attention?
Rewatching it, I saw a couple cuts that she made when she was clearly talking to the camera or focused on what she was saying to them.
First of all, I shouldn't even have a video of what happened on the surgery table. Like, that is actually crazy to think about. I almost hit the boom. You're welcome. You should not even have. Why does she have a TikTok live recap of what happened on the surgery table? Like, that is actually so crazy. What? Unfortunately, a lot of her content has been wiped from the internet, so I did try my best to compile all of the resources, video, news articles that I could. We're going to get into everything. Make sure you like the video and subscribe to the channel down below. Dr. Catherine Roxanne Grawl, known online as Dr. Roxy, was a board-certified plastic surgeon based in Ohio. She had her own private practice named Roxy Plastic Surgery. She gained a massive popularity on TikTok by offering medical advice, live streaming surgeries, and sharing popular trends and memes, amassing over 800,000 followers on the platform. Like other medical creators, her content provided viewers with a behind-the-scene look, making complex medical information accessible and entertaining. However, her online presence quickly raised serious concerns to viewers. Dr. Roxy often filmed and interacted with her audience during active surgeries, sometimes addressing the camera directly while performing procedures while being live on TikTok. Patients were having extreme complications due to malpractice and negligence. These injuries were not like your typical BBL breast augmentation injuries. These were like, what are you doing kind of injuries. Mistakes that board certified surgeons simply don't make. During a live stream liposuction procedure, Dr. Grawl addressed the camera, diverting her attention from the surgery. This lack of focus contributed to the patient suffering a perforated intestine.
Went into her office and it was brand new. And she was like, well, I got to get some information. So I noticed the paperwork. And I was like, oh, okay, this is generic paperwork. And so when I read the information that she had typed up, I was like, there should be a comma here. And this word is spelled wrong. And I mean, because it was that new. And she was like, okay, great, Mary, I should have you come in and do, read all my paperwork. Don't have time for that. We talked about having the tram flap with the tummy tuck. And she told me that I was a perfect candidate. You know, it would give me the opportunity to have my breast back. And I was like, man, and I can get a flat stomach out of it. I didn't know she was renting ORs at the time. So it was like, okay. So on the 22nd, I'm gonna never forget, it was 6 o'clock in the morning. My family was there and I was ready to go under the knife. I had my cell phone with me, which is crazy. I was taking pictures because I said one day I was gonna write a book and I wanted to have all these pictures. So the anesthesiologist, the nurse, like a picture of her. I mean, it's like, we're going to do this. I had no idea what I was really doing because those photos and all the photos that I took actually supported my claim when we went to court. October 22nd, had the surgery, woke up to a breast, flat stomach, like, oh my goodness, this is real, okay. And then I went to sleep. And when I woke up, the tissue was like this big, which meant something was wrong. Nurse, something's wrong, nurse, something's wrong. Called the doctor. No one had the phone number, which is crazy. Fortunately, I had her cell phone number because I actually was engaging with her prior to. So I gave them her cell phone number, and when they came back in the room, they told me that she couldn't come in because she was having dinner with her family, but ordered leech therapy, as in leeches, like leeches.
I didn't even know anyone still did that.
They do that for like fingertips. They don't do that for, you know, big tissues. There was no one in the hospital that knew how to do it. And so my friend Kia literally Googled how to do leech therapy. And she was the one that put the leeches on and showed them. And so while she was doing it, the nurses' stations would come in and stand around the bed and watch the woman who's having leech therapy. Then the first attorney that I had reached out to literally told me it wasn't possible that I could win my case. He said, you got a case, but I don't see you winning it because, and I hate to say it, but she's a prominent white female doctor and you're you. And I was like, what's that supposed to mean? Because I wasn't thinking along those lines in any way. And so he said, but I can refer you to somebody. And he was like, so tell me what happened. And I gave him the quick summary, told him I had pictures, and he was like, okay, let me see. And I showed him, and he said, okay. And he asked, what did I want out of it? And I told him, I want her license. And he said, you know, most people don't want that. They have some type of dollar amount. I said, I'm not in it for the money. I don't care about the money. I care that she is not able to do this to anybody else ever again. And so we went to court. And I won the case, and she appealed. And then I won the appeal. And unfortunately, the medical board didn't make a decision to discipline her then. And by then, she was on a whole new scale because she had become TikTok famous, and they had reached out to her in 2018. I think they believed they had already started correcting her, so they might not have needed to do something else, but they didn't do enough.
From the very beginning, all I wanted was her to lose her license so that she couldn't do this to anybody else. Because what I endured, the 6 months that I fought for my life, I didn't want anyone else to have to deal with it.
And I did have a chance to confront Dr. Roxy as she was heading out from the meeting. I said, how do you feel about this decision? But her and her representative said they are not giving a comment today.
Another patient experienced severe post-operative complications after a procedure that was partially live streamed on TikTok. The patient required intensive medical care to address the issues arising from the surgery, leading to prolonged medical interventions and recovery time.
But what drew me to Dr. Roxy was that she was a woman. And I'm not saying anything against male plastic surgeons, but I feel like a female plastic surgeon better understands the female body because she has the same parts I do. So I watched Dr. Roxy on social media for 2 years. I followed her on Instagram, and then I got on her Snapchat channel. I watched her surgeries daily for 2 years. And I did the consultation, and it was a virtual consultation. I never got to talk to her like face to face or anything. I had to take a bunch of pictures and then send them in and tell her, what I liked, what I didn't like. Like I went through and circled certain areas, and like I did a close up of some areas. And I wanted to concentrate mostly on my breast. The doctors there did a swab of it, and they said that I had cellulitis, and it was most likely caused from an unsterile surgical setting. And when I go back and I watch the video of my surgery, they were coming in and out of the OR. In the OR, you cannot have anything go below the sterile field, which is anything from the waist down. And they were coming and going through the ER. And they did a swab. They said, "Yeah, you've got a post-op infection. Here's some medication for it." 6 weeks post-op, I was doing a dressing change with my husband, and I had something called wound dehiscence, and that's where the wound literally rips open. We were putting the dressing on there, and like we actually watched the skin separate out, and it terrified me. I was convinced, because I'd also been picking stitches that were just like coming undone and just poking through the skin, and I'm like, this is not normal. So we went back to the the ER. And I walked in the ER holding my breast, and they're looking at me like, "Why are you holding your breast?" I'm like, "Because it's going to fall out." I was convinced that it had ripped open and it was going to fall out. I was convinced. So they said, "No, it's not going to fall out. There's all kinds of layers there and everything. I know it's probably very scary, but it's not going to fall out." We talked to Dr. Domingo the next day, and Dr. Domingo had the audacity to tell my husband, "Stop taking her to the hospital." He told my husband, "Stop taking her to the hospital. They're filling her head with these ideas." They sent a swab of my breast to the lab, and the lab says she has cellulitis. So it's not that they're filling my head with these ideas. This is really happening.
And despite previous warnings, Dr. Roxy continued her online activities, leading the board to determine that her actions compromise patient privacy and safety. In July of 2023, with a vote of 7-0, the board permanently revoked her medical license, citing a lack of professionalism and concerns that her continued practice posed a danger of immediate and serious harm to the public. She also had to pay a fine of $4,500.
But her lack of professionalism and poor judgment in delegating responsibilities to others appears to have significantly contributed to her falling below the standards of care.
Stern words from Dr. Jonathan B. Fable, just one member of the 12-member board tasked with investigating complaints and issuing, or in this case, revoking license as deemed fit.
Dr. Roxy claims that this will change her life forever. Well, she has single-handedly forever changed the lives of at least 3 people.
It was the concerns of not meeting the standard of care that brought the physician to this point. As early as 2018, Dr. Groy was asked to address concerns of patient privacy on social media. The plastic surgeon often posted behind-the-scenes video, often shot in an operating room. The board also sent notice to the surgeon explaining 3 patients treated from 2020 to 2022 were treated inappropriately or given improper discharge papers. Those concerns, plus others, including a recovery house run by the surgeon not staffed by medical professionals, and surgeries performed in an office setting without the proper licensure, were all evaluated by the board.
And sometimes I did silly or fun videos, simply to make people smile in this world, which is often negative and difficult to navigate.
And for the first time, the physician spoke publicly, calling the initial suspension humbling and pleading for another chance. But for former patients at the hearing, the plea simply wasn't enough. Former patient Mary Jenkins won a civil case against the former doctor. She says the license revocation is in a sense closure, but adds the damage she and so many other women live with will never go away.
It'll never go away, because every time we look down and we see a scar, we're going to remember.
I personally think she got off pretty easy. I thought that there was going to be a much higher fine, possibly jail time, some type of, but imagine going to school for like 10 years to become a plastic surgeon and you lose your license because you wanted to be on TikTok. It's unfortunate. This case highlights the ethical dilemmas medical professionals face in the age of social media. While platforms like TikTok offer opportunities for education and outreach, they also demand a careful balance between transparency and patient confidentiality. The allure of online fame should obviously never overshadow the care owed to patients, and Dr. Roxy's story serves as a cautionary tale about the potential pitfalls of blending medical practice and TikTok. What are your thoughts about medical professionals sharing content online? I think that if you are a content creator who just so happens to be a doctor or a surgeon, I think that's totally fine. And I think that the online communities that exist are a great place to share knowledge, especially because there is a lack of resources and insurance in this country. So a lot of people aren't going to see doctors. A lot of people aren't getting expert advice from a lot of people. A lot of people only have TikTok to depend on. So it can be quite dangerous when these people have this blind faith and trust in these content creators and going and getting surgery with them. See all the followers, you see that people are trusting their advice, you're seeing the before and afters, and you would think that, oh, I'm just going to book an appointment with this surgeon on Instagram or TikTok and everything's going to be great because I've seen what they do and they've already done all of this. But I think what happened with Dr. Roxy is that it's not that she wasn't that good at her job. It was the fact that she was just kind of caught up in multitasking, content creation, and the surgeries. But I think it also was really interesting to cite that Dr. Roxy said that it wasn't the live streams and content that caused the complications in her patients. And I'm thinking that if it wasn't you live streaming on TikTok or making content, then it must be that you just aren't really that great at giving surgeries. I don't know. What do you guys think? Please let me know down in the comments down below. Don't forget to like and subscribe. Thank you so much for your time and your energy, because that is absolutely what? Priceless. And I will see you in the next one. Don't get plastic surgery from TikTokers.